Welcome to Masterspharma Academy. After a long break, we are finally back with a fresh content. In today's session, we will discuss some pharmacology MCQs. The first question, drugs that bind to receptor and activate them are called agonists, antagonists, inhibitors and modulators. The correct option is agonist. Agonists are the drugs are endogenous molecules that bind to a receptor and activate them, producing a biological response. They have two key properties, affinity and efficacy. In affinity, they have ability to bind the receptors. In efficacy, they have ability to activate the receptors. Because they both have affinity and efficacy, agonists can stimulate the receptors and mimic the action of natural ligands like hormones and the neurotransmitters. The second question, which of the following is a selective COX-2 inhibitors? Aspirin, ibuprofen, diclofenac and celecoxib. The correct option is celecoxib. Celecoxib is a selective COX-2 inhibitor. It selectively blocks the COX-2 enzymes which is responsible for inflammation and pain while sparing COX-1 which protects the stomach mucosa and support the platelet functions. The third question, depot preparations indicates dash route of drug administration, oral, intravenous, intramuscular and intrathecal. The correct option is intramuscular. What is depot preparations? Depot preparations are special long-acting formulations designed to release a drug slowly and steadily over an extended period. These preparations are specifically meant for the intramuscular route because muscle tissue act like a reservoir, so the injected drug stay in a muscle fibers and released gradually. The next question, which of the following anti-epileptic drug acts by blocking sodium channel? Valproic acid, ethosuximide, phenytoin and diazepam. The correct option is phenytoin. Phenytoin is a classical anti-epileptic drug that works primarily by blocking voltage-gated sodium channels in neurons. Phenytoin works on sodium channel blockers, which prevents the rapid neuronal firing. The next, glucocorticoids acts through tyrosine kinase receptors, nuclear receptors, ligand-gated ion channels, and metabotropic receptors. The correct option is nuclear receptors. Glucocorticoids acts through intracellular nuclear receptors, not on the membrane receptors. Glucocorticoids like cortisol, prednisone, dexamethasone are lipid-soluble steroid hormones. Because they are lipophilic, they easily diffuses across the cell membrane and enter the cytoplasm. Therefore, glucocorticoids works by regulating a gene expression through nuclear receptors. The next, black water fever is rarely the adverse effect of continuous use of the below drugs: halofanitrin, mefloquine, quinine and artemisinin. The correct option is quinine. What is black water fever? Black water fever is a rare but serious complication associated with continuous or repeated use of quinine, causing a massive hemolysis and dark black urine due to hemoglobinuria. The next, which antibiotic causes gray baby syndrome? Gentamicin, tetracycline, chloromophenicol and erythromycin. The correct option is chloromophenicol. Chloromophenicol is metabolized slowly in newborns due to immature liver. This leads to drug accumulation causing grey skin, hypotension, vomiting and collapse. This is known as the grey baby syndrome. The next, which drug class milk causes a cheese reactions? SSRI, selective serotonin reuptake inhibitors, MAO inhibitors, monoamino oxidase inhibitors, tricyclics, SNRI, serotonin norepinephrine reuptake inhibitors. The correct option is MAO inhibitors. Cheese reactions is a dangerous hypotensive crisis that occurs in patients like MAO inhibitors when they consume foods rich in tyramine such as aged cheese, fermented meat, red wine and pickles food. The next, which diuretic is potassium sparing? Furosemide, hydrochlorothiazide, spironolactone and mannitol. The correct option is spironolactone. Spironolactone is a potassium sparing diuretic because it blocks the aldosterone receptor in the collecting ducts of the nephron. Spironolactone works on aldosterone blockers and kept the potassium from losing. The next, which of the following causes Redman syndrome? ciprofloxacin, vancomycin, linezolid, and rifampicin. The correct option is vancomycin. Redman syndrome is a histamine-mediated reaction classically associated with a rapid IV infusion of vancomycin, leading to histamine release and flushing of face, neck, and the upper body. Thank you.